right, we are doing it again. Last Friday of the month, we're back with another live Q&A. Thanks everybody for jumping on. I'm Ben Ceccarelli, Chief Brand Officer here at StemWave. We do this every couple of weeks, these live Q&As with some of our, providers that stand out in our community. We get a behind the scenes look at how they're using StemWave in their clinic, what kind of results that they've seen, what their journey looked like when they first got started. And there might be people that are tuning in or watch this later that are curious about StemWave. Maybe they're on the fence, and that's what this whole Q&A thing is for. Real talk from our providers. Hopefully it answers some questions that people may have and gives a clearer picture of what's possible. So let's get into it today. Very excited. We get all sorts of different providers on these Q&As today. We have a PT. We're joined by Robert Funk from Providence Health Solutions in Vestavia Hills, Alabama. So, Robert, welcome.
Thank you. Glad to be here.
When I first was looking over your clinic and I saw Providence Hills, StemWaves, we're based in Boston. I was like, oh, must be a New England provider. Nope, you're in Alabama.
No, it's more of trusting in the providence of God is where the name comes from.
Understood. So I always like to kick these off with a little background on our provider. So tell us a little bit about who you are, where you come from, how you got to where you are today.
Yeah, so raised in Texas, very large family, have 10 brothers and sisters. Went to Texas A&M where that's where I first became interested in going into physical therapy. Was interested in medicine, but found that family is a high priority for me, and I found doctors don't have a lot of times with their family. And so I started gravitating towards physical therapy, transferred out to Auburn, finished my degree there, and then went to the University of Alabama at Birmingham for my physical therapy degree. And that was back in 1990. So I've been practicing now for almost 35 years.
Wow, you seem to go to all the schools with really fun athletic programs.
Yes.
Wow. And then so, after, finishing off in Alabama, what was like the reason to even get into physical therapy? Like, was there something that sparked your interest from early on?
So I love patient interaction. I love working with people. I love the aspect of trying to help people regain their function, get back to doing what they love doing, and uh, just really developed a passion for that.
Yeah, I think as I talk to providers week after week, that seems to be the through line, and also obviously why they end up becoming STEM-weight providers because they really do care about providing the best and highest quality to their patients. So, how did you form your clinic after knowing that this is the direction you wanted to take your profession?
Yeah, well, it was a long process. So when I first started practicing, I was in a number of different fields. I was director of a hospital for a short period of time, inpatient and outpatient. Then decided it was time to open up my own clinic. And I did that for several years. I had a partner. He was a business partner, handled the business end, and I got to take care of the clinic side.
That's a smart idea.
Yeah, it worked out really well. Um, he was wanting to go another direction. And so as we talked, I found another company that we were like-minded and merged with them. And so they again provided a lot of the business end of it while I was able to focus on the clinic. I just had two clinics at the time. We branched out. We had about five or six more together. They then became the largest physical therapy provider in the country since that time. And we started kind of going into different paths. And I got tired of sort of the corporate environment and decided that I wanted to kind of sell out my interest and pursue more one-on-one patient care. And part of it just there was a lot of things kind of going on at the time. I was working with a lot of patients. We felt like we were providing really good quality care, but there was always kind of these chronic conditions, had underlying symptoms that just weren't able to see get them over the hump kind of
Mhm.
thing. And so I got an interest in functional medicine at the time. And so I started pursuing more education in that realm so that trying to get to root cause of problems. So it's kind of big now. There's a lot of issue with getting at the root cause of inflammation and all these other things. And so started looking into diet and lifestyle. We even look into genetics, and we look at the microbiome and sleep patterns and exercise levels. And so trying to bring all of that stuff together to help patients recover from things that are making life difficult. So
Wow, that's fantastic. I love that you're doing all of the aspects because there are so many different touch points to figure out how you can help somebody, especially nowadays. We have so much at our fingertips. Like you said, like checking out somebody's gut biome. Like we
yeah,
can do that.
yeah,
There's like at-home kit. I've done it. Like there's
yeah,
at-home kits you can do, and there's just so much information. Um,
yeah.
and your wife is an RN.
Right. Yeah. So my wife's a nurse, and she's done a lot. She's done with pediatrics. She's been in a number of different fields. But when I was looking at sort of leaving my clinic, that's when we were talking about getting into functional medicine. And that's always been an interest of hers. She's had chronic pain herself.
Mm,
She had Lyme's disease for a period of time, and just lots of joint pain. It's like there's got to be a better solution than just giving medicine for the symptoms.
no.
And so we both had a strong interest in this area. And so we both started studying and getting our credentials for practicing functional medicine.
Awesome.
And
Now,
so she also she's gone through a lot of training with me for uh, laser therapy that we use. We use that for treating neuropathy. She went with me through the training for the shockwave and everything else. So
yeah, I was actually going to ask, as you mentioned, there were, when you started your clinic, there were some cases that would come in that you just wouldn't have the ability to do anything for. What were some of those things that you saw that you was just like out of reach at the time?
So, a lot of at that time it was like fibromyalgia, different things like that. These chronic issues with pain. Sometimes people would have like an injury and they just would not recover well, or a surgery and they would not recover well. Something in their system was keeping them from really healing.
Hmm. And you mentioned laser. Were there
Mhm.
any other modalities that you brought on early on?
Really, laser was really I was sort of an early adapter of the laser. I've been using it for over 10 years. And at least I think I was an early adapter. No one else had them at the time. And as I was treating patients, just to kind of help speed up their recovery was my original intention. Um, there were neuropathy issues, people that had nerve pain that would see benefit from it. And so we started using that. I was really very happy with the laser. We kind of upgraded to more sophisticated lasers as we went along. We've since kind of added in light panels.
Hmm.
So I don't know if you're familiar with the Juve. We have light panels, vibration plates, and of course I have decompression tables to help with a lot of spinal injuries and stuff. And I'll use a lot of modalities in conjunction. And there's never been one modality, even the StemWave, that can just fix everything. But there are tools that I've come across, StemWave being one of them, that have really been a great adjunct to things that we are doing to help people heal and help people heal faster and feel better.
Yeah, and get them over that hump that seemed impossible before. So
Yeah.
glad you mentioned StemWave. Um, how did StemWave get on your radar? You're using all these other things. You're into functional medicine. Like, how did we first pop up on Robert Funk's radar?
Yeah. So I've kind of always sort of had an interest in different modalities, just as ways to uh, help patients get better faster. And um, the one company that I use the laser with, they came out with a little percussion wave,
Mhm.
radio wave, I guess you would call it. And they also said they had a shock wave, and so I started looking into that, and even had them come do a demonstration, and it looked positive, but I wasn't really sold. And I was at a function with another, it was a chiropractor, and they were talking about getting this thing called a piezo wave.
Mm-hmm.
I thought, okay, that sounds similar to the shock wave. And so then I just started investigating. I said, okay, people are seeing results with these things. I want to find out, what's happening and how it's working, which one's the best one,
Of
and
course.
started talking to people that have them and to what their experience is and kind of the science behind it and everything. And so in that research, I saw the STEM wave. And so I thought, well, what's the difference between the STEM wave and Chattanooga's
Right.
version and the radio pressure wave? And so as I did, I became more and more impressed with some of the things I was seeing with the STEM wave. And then I started talking to your company, and uh, I really the customer support from the StemWave group, it 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 just like was head and shoulders above any other company. And then just seeing kind of the science and thinking, okay, I definitely want to go with a true shock wave, not the percussion wave, not the piezo wave, and whether I wanted focused or unfocused. And so just looking through all of those things, just kind of weighed it out and thought, well, the STEM wave seemed to really be the best option.
That's awesome. Yeah, there are a lot of options out there. I'm glad you did
Yeah,
your research. We always want people to look into it and see the same sort of things that we've seen and we try to promote. But you really need to see for yourself. You really need to go and do the research, look
yeah,
at the science. It's great to hear that you had such a positive experience with our team when talking to them. I think that's a good point to
absolutely.
bring up. I know a lot of people, they get a little nervous about talking to somebody on like a sales call, especially for like a medical device. Um, Tell us how your experience was just talking to our sales team throughout the whole thing.
Oh, yeah. Really, I didn't feel pressure. Um, but you had the 60-day try it out, and it was like, uh, it's a very expensive piece of equipment, but I bought expensive equipment before. And I bought a laser that was probably similar in price.
Mhm.
Um, did not get near the customer support, but that's another story. Anyway, as I talked with them, sales experience was really good. I They referred me to a number of clinicians that had been using the device. I talked with them. I even kind of ended up calling. Went on a Google search, found other guys that had StemWave and just asked them.
Yeah.
Found some people that said they had a StemWave, but it wasn't a StemWave. But
Trickery.
yeah, yeah. But they put me in contact with some good uh, PT, chiropractor, and about how they're using it, what kind of results they're seeing. So I don't know, sales experience was really good. And I felt like, okay, I'll have enough of an opportunity using it for 60 days to be able to determine one, if it's helping the patients that I want to help, and two, if it's worth the cost.
Yeah, and I'm glad you brought up that 60-day thing. Some people may not even know it exists, but yes, we have a 60-day, put it in your practice, try it out. If you don't like it, you send it back, you don't pay for it. And we can do that because we believe in it so much. And
Yeah,
we have a 98% success rate for a reason. It's the device works incredibly well and we have great success with it, but we stand behind it. And we know that for a lot of people, bringing in a new medical device is not a simple thing. It's not
right.
in their mind, at least. I mean, we try to make it as simple as possible, but it's like a whole new world for some people who just have been doing like manual therapies their whole time. So we really want to make the barrier of entry as low as possible. Hey, no pressure. Try it out 60 days.
Yeah,
We're pretty sure you're gonna love it. So
yeah.
I'm glad that you recognize that, you took advantage of that, and yeah, tell us a little bit about what those first 60 days were. I'm sure you went to a group training.
Did almost right away. I went to Tucson, Arizona. My
Okay,
son actually lived
Dr.
out there.
Morris,
Yes, yes.
fantastic.
Yep, yep. And so you mentioned my experience with the sales team, but it's really kind of the support team that has been the most impressive to me. because you're not just kind of left out there hanging.
Yeah.
One, I think doing the in-person training crucial. You got to do it. It's very necessary. But there's tremendous online training and education. I've had Sydney has worked with me. She's one of kind of the support personnel. I can reach out to her anytime, and she's there to help. Marketing team has been super helpful, and I have not taken advantage of them as much as I should have. Um, so, because we kicked off really fast, and I've really gotten more business from patients that have benefited and referred friends.
Yeah.
So, um, and I didn't mention this, but really kind of kicking off my company. I'd been doing some stuff, different clinics. I even kind of worked out at gyms and doing some different things before I kind of started back into my own practice. I really just kicked off this year with it. And I had the laser and everything already, but
Mhm.
really kicked off with the StemWave. And just doing that initial marketing push with the StemWave made a huge difference in helping me get off the ground.
That's fantastic. Yeah, there are so many things that we're going to touch on. You mentioned how you had a laser at one point that was around the same price point, and there was not nearly the same support. And I think
Yeah.
it's important for people to understand. We get it that traditionally you buy a medical device, they drop it off at your front door, your clinic, and then you never see them again. You never hear from them again. You're on your
Yeah.
own. And that's where we like to separate ourselves. I mean, we're with you the entire time. Like you mentioned, we have so many different parts of the company to make you successful and help you and hold your hand through the whole thing and make sure you're supported. The group training is one of those. We touched on a little bit. I want to talk a little bit more about the group training. People may not know, but we have locations all over the United States. So when you're interested in being a StemWave provider or you've just purchased your device, you go to a group training, you're among your peers in the medical community. There's doctors, there's PTs, there's chiropractors, there's MDs, there's naturopaths, there's all these different people, and you're all getting hands-on experience together. What was your training like with Dr. Morris, who's fantastic, one of our most fun clinical advisors in Arizona? What was that group training like? Had you ever been a part of something like that where you have all these medical professionals together and getting hands-on training?
I have, yeah, with some different things. But it was a great experience. I mean, very uh, personal, able to interact, got to actually go through some training using the machine.
Yeah.
I actually had gotten the machine a few days earlier and had been kind of practicing doing some things, going from the videos and that sort of thing. But really, kind of getting with someone and that knows what they're doing and directing you and getting to practice on it. And some of the other folks in there had been using it some too. And so the interaction, and we had chiropractors. There was two other physical therapists that were there, another physician that was there, and um, and good interaction between everyone because coming from different sort of perspectives and how they're using it and what they see the benefits. And yeah, it was a great experience.
Were you able to, well, you had your device before, but a lot of times at these group trainings, the providers, it's their first time, even getting hands-on with the device. Sometimes even like they'll get treatment on themselves and they have
Yes.
that aha moment. Did
Yeah.
you have any experiences like that at your group training?
Yeah. I'm glad you brought that up. So when we went to Tucson, my wife and I love to hike. And so unfortunately, she stumbled. I grabbed her arm to keep her from falling and injured her shoulder.
Oof.
Yeah. And so when we were doing the practicing, she said, well, my shoulder's kind of hurting. And so we did the stem wave on her shoulder. And it was like immediately she felt better. So it was
In the
like that
training,
was
at the training.
at the training. Yeah.
Wow.
So, and she hadn't gotten to practice with it yet, like I
Yeah.
had. Um, so that was great. And I
Yeah.
don't remember, other people treated other things. There was another guy that had a upper trap chronic issue. And I actually don't really remember kind of how he, ended up afterwards, but but my wife, it made a huge difference. And then I treated her again, when we got back, and she actually did well for several weeks, and then kind of started hurting again. And so did it again, and she was like, that seemed to be the only thing that really
Yeah.
helped it feel better. So
I always think that's the coolest thing. I've been lucky enough to be at some group trainings. It's my favorite part is watching like medical professionals, like even they're there, so they're on board, but they're still a little skeptical. Like they're
yeah,
still like I don't
yeah,
know. And then they
yeah,
have some like chronic injury or like old football trick knee or whatever it is, and they get treatment at the group training, and you can see them be like, wait a minute, like why does this feel like looser now and like more free
yes,
and they almost try to like re-injure it right in front of you just to like make sure like they're not going crazy. Like this is impossible. So
yeah,
that's cool that your wife had one of those experiences at the group
yeah.
training.
And I don't know if you're familiar much with fibromyalgia, but
Yeah,
she'll get hurt and it'll just hurt for forever.
yeah.
And there's this kind of chronic systemic inflammation going on. And we're implementing some of the things that we've learned in functional medicine, and she's
Mhm.
doing better. But it's like um that was the it I didn't really I'd heard good things, about the shockwave and people seeing some immediate benefit and stuff, but yeah, I mean it was significant.
So you have this, cool experience in Arizona. Your wife gets treated. By the way, very cool that, she's there at the training too, so she gets trained on StemWave. Being a
Yes,
nurse, that's
yes.
fantastic.
Yeah.
And then you come back and walk us through how you started implementing it into your patient base.
So there were some folks that I was already seeing. I was working with another therapist. Oddly enough, I'm really kind of doing this on the cheap. I'm renting space out of another physical therapy clinic.
Yeah.
And so I've been seeing some of their patients, and then they're now also referring patients to me. And so that's really kind of how we first started. There were, again, patients that they were having kind of getting over certain issues. There's one lady, for instance, she had strained her hip, chronic hip pain for over 2 years. And it was actually, she had an MRI. It showed some inflammation of the quadratus femoris. Um, so she was complaining about pain right around her ischial tuberosity. It just wouldn't go away. Hurt was sitting constantly every time she sat down for any period of time. 2 years. And she'd get a little bit of benefit from some of the stuff that was going on, but nothing else. Um, she felt immediate benefit. We did both the stem wave and the laser.
Mhm.
And of course, we're doing some myofascial release, doing some dry needling, all the other stuff too. Showing her some exercises, trying to get her to recruit her glutes better and all that other stuff. But anyway, so we just incorporated the stem wave with all the other things, and she started seeing some improvement. After, I think it was probably about 10 visits, she was like, it's not hurting anymore. And she's like, for 2, 3 months, she said, there is no more pain.
Wow.
Yeah. So that was pretty cool.
That's
And,
very
and
cool.
my associate pastor had an old knee injury. This was probably 20 years old, bad motorcycle accident. He loves to bike, but he started noticing over the past few months chronic swelling. It would just swell up after standing for just a couple hours. I said, well, I've got this new device. And we'd done laser before, and that's kind of helped him too. But we did the shock wave, and he was like, 2 or 3 days, he said, it did not swell,
Wow.
but didn't heal it all the way. So we did a full treatment and went through 10 visits, and I had to have him back down on his biking because he would feel good and he would just ramp it right up.
Yep.
And so I had to kind of train him down. That was part of my learning curve too, is training the patients on what to do afterwards. So anyway, but I think we ended up doing 11 visits, and he said, it feels like a new knee. And
Wow.
he got back into doing his regular routine, mountain biking, all that sort of good stuff. And this was a chronic injury. And I imagine we'll have to do some follow-up,
Yeah.
you know, every now and then, but it got it well under control and took care of the chronic swelling.
How does that make you feel to know that there are cases that previously you just weren't able to do anything for. And
Yes.
now you're able to get like somebody who's like the pain's gone, like completely
Yeah.
gone.
Yeah. I mean, it's awesome. It's
Right.
like, it's one, as a physical therapist, that's one you want to help your patients, right? And when you kind of hit roadblocks, it is really discouraging. You you know, I have never been one to say, well, it looks like you're just going to have to live with it. And sometimes that's the case, right? I mean, sometimes there's just a certain level of pain people just have to live with. But you just don't want to give up, right? You want to help. So so being able to kind of get people back to enjoying the things that they want to do, spending time with their grandkids. And that's been a big thing. I've had shoulder patient, he said every time he raised his arm, he's lots of grandkids, everything else. And he said, you just can't do much with it. Started doing the stem wave. He had uh, small rotator cuff tears. They diagnosed it with an ultrasound, and but they said, you might be able to rehab it. So we did. It was all part of our program. We did rehab it, but he said that shockwave, he could tell, just really helped that to heal up. And he was thrilled. And he doesn't make a lot of money either, but he said, this is worth it.
Yeah. Yeah, especially when they feel that first treatment, which is
Yeah.
why a lot of our providers, offer a lower cost first treatment because they know if you feel better after the first one, then you're not going to have that big of a problem paying for, the next one and the next one if you're on that track of getting better and getting pain free. There's no
Right.
price you can put on feeling pain free. And
No.
I'm glad you mentioned like this feeling of, sometimes people think like, oh, I'm just going to live with pain. And
Yeah.
we talk to patients. We do this YouTube video series called the Impact Series where we go and we fly to different clinics and we sit down with StemWave patients and we hear their stories. And a lot of times it's that exact thing. They say, I asked them about how their pain was before, and they say, yeah, I just thought it was something that this is just the rest of my life. I mean, young people too, 30s and 40s, they're saying, yeah, this is just the way the rest of my life is going to be. And when you can offer them a solution, like to get rid of that
Yes.
pain, there's nothing better.
No. I, I, I treat neuropathy, and we've been using the laser to treat that with some good success. Had a young girl, Friedrich's ataxia,
Hmm.
which is a genetic disorder. And she was benefiting from the laser. He said, but we did the shockwave on her feet. And so this is a genetic disorder. So it's not, and she was starting to get the feeling back in her feet. And she was like, she went to the beach. And as she walked, she said, I can feel the sand on my feet.
It's
And she
little stuff.
was thrilled to death. And I mean,
Yeah.
it's not like she couldn't feel it before, but it's like she can feel the grit and she can feel the water splashing on her feet. And just being able to, she'll kind of need sort of treatments. We don't
Yeah.
really even know how often we'll need to keep doing it and stuff, but just the fact that she's able to get that sensation back. There's no good treatment out there for neuropathy except for the laser and the shockwave
Right.
that I've seen. They just give them medicine. They say you
Or
just
they
have to
cut them open
live with it.
or they cut
Yeah,
them open.
yeah.
Yeah.
But she
That's,
saw physical, real difference,
yeah.
and so that was exciting.
It's exciting and it's also it gives people hope back in their life. And this is something that
Yes,
I personally like to touch on because I see this a lot in that Impact Series stuff that we do. And I like to talk about this with StemWave because I think it's important for people to know. Like, yes, the technology is amazing. It's groundbreaking, cutting edge. It absolutely works well. And on top of that, there's an emotional aspect where you
yes,
can give someone their life back. Like, and it sounds like a little poetic and a little romanticized, but it's true. When you have somebody that's talking about, I can feel the sand again, I can feel the water,
yeah,
that changes somebody's life. Like all of a sudden they're a different person. All of a sudden now life doesn't feel so hard and they're a better husband or wife or son or daughter, whatever it is, because they're not in pain. And
right.
it's magic.
Yeah, I'm glad you mentioned that because that's really kind of my motivation of wanting why I got into the laser and why I started looking into the shockwave was to give some people hope.
Yeah,
And I mean, it literally can be life changing for some people. And
100%.
Yeah.
So let's talk a little bit more. You touched on it a little while ago about, the support side that you've received. You mentioned Sydney. She's the
Yeah.
director of our client success. But we have a whole client success management team that when you become a StemWave provider, you get assigned a dedicated client success manager, and they walk you through onboarding, and they're there for you whenever you need them. If you have questions, if you need help with anything. What has your experience been like working with your CSM, client success manager?
I'm sure they're all great, but I think y'all gave me the best one. Syd- Sydney's been awesome. And I mean, they, I, I'm not real savvy with kind of doing the online stuff. And and your marketing team is really good at that as well. I've never had a big online presence and still don't really have much of one either. But that's one thing they're helping me work on. But yeah, any issues I've had, one time I had a bad electrode,
Mhm.
and I mean just took care of it right away. And sent me out a new one, drop shipped it, gave me some little extra trinkets along with it. And but it's like if there's an issue, it's like I don't know. There's just you've got someone you can call and they'll address it,
I
you know.
mean, and that gives you a sense of comfort, just
Yeah,
to know. Because like I said, I do know that there's a lot of devices out there that's not the case, that you're kind of
yeah.
on an island once you have it.
Y'all have made an investment in these people. I mean, because that's not things that other companies have. So I know it's not cheap to do, but it's very valuable. Just having someone that I can reach out to and that is very responsive.
Yeah, I mean, look, I think people should know this too. The mission of StemWave, despite having this unbelievable device, and of course we want to put them in every practice and sell them and stuff, but really the mission is to change traditional healthcare. Like as much as you want to help people, we want to help people. So we want to make that as easy as possible. We want to make you all successful. And the best way we can do that is by providing you with un like a support level that is unmatched in
Yeah.
this entire arena of medical devices. So I'm really glad that you've been having such a great interaction with your CSM and you have that confidence. I know you mentioned that you haven't really utilized a lot of the marketing stuff yet, but it is important, I think, for people to know that outside of like the digital marketing and all that kind of stuff, which we do have, we also provide when you become a StemWay provider. We have like a bunch of trifold brochures that we send you, and like a pop-up banner for your waiting room, and we have all these different marketing materials, like printed materials that you can use to kind of get the word out as well. And one of my, I don't want to say favorite, but I think is one of the strongest things that I think we offer is this sense of community. And
Mhm.
we have this online platform called School. It's the home to all of our training videos, which you talked about, like you went through all of them, as well as message boards with all of our providers. We hold coaching calls with our clinical advisors. Have you taken advantage of like the community aspect of being a STEMWay
Oh,
provider?
absolutely. Yeah. So school is great. I still use it, even 6 months later. But initially, it was very beneficial. You could type in a message to one of the doctors, or just put it on the board, and you would get responses from here's what I'm doing, and from the physician, here's what I think you should do, or they'd ask me questions, get more specifics, and so great interaction on the school. Because there's several aspects to school. One being the classroom, and then this message board that you have. So yeah, I've used that frequently and gotten some good information. So I'll scroll through it actually and look at what other people are asking and say, oh yeah, I need to know about that. And so I'll look in the responses to that they got to their issue. So looking at sciatica or whatever,
So
like I say, I just started treating my own carpal tunnel and
oh,
have gotten really good results. So
I mean, that's always a plus. And that's one of the things as well. When we talk to providers, more so that have been using like manual therapy for most of their career. And we're like, look,
yes,
that's very hard on your body. Like I'm sure you're feeling it, especially, if they've been doing it for 20, 30 years. uh, we were saying like, hey, you could start stem waving that on yourself, as well as using stem
Yeah.
wave is going to be a lot easier on your body, but you can start stem waving yourself and, heal those injuries. So that's cool that you're treating yourself for your carpal tunnel. Um, alongside of what we were just talking about with the community aspect, these message boards are incredible. I peruse them as well sometimes, and to be able to see providers say, hey, I had this patient walk in, and maybe it was a fibromyalgia thing, or maybe it was a neuropathy thing, or maybe it was bone on bone, or something they hadn't seen before. And maybe they're new to StemWave. Within minutes, we have providers from all over the country. We have over 750 providers in the US right now, and we're growing every month. And so to have that many providers be able to chime in and offer up, hey, I saw that before. This is what we did, and we had great results.
Yeah.
I mean, that's like a cheat code
Yeah.
almost.
Yeah. So early on, one of my mistakes was I was probably putting in too much power. And so and as I got on the message board and stuff and started talking, that was like they started asking me questions. And so, yeah, I went up too quickly on how much power and how many waves I was doing and just tried to push it too fast.
Yeah.
And that's just from the interaction with other clinicians that have been using it longer.
Yeah, and I would say that's pretty typical.
Yeah.
There tends to be this like, well, if a little is good, then a lot will be even better. But
Yeah.
that's not the case, and I'm glad that you were able to get that information and make the right tweaks and have great results. I want to take a second right now, and for everybody that's watching live, we've got in this Zoom, we've got a little chat here in the little chat box. You can find it at the bottom of your Zoom. It says chat. If you have any questions for Robert about his journey, how he's using StemWave, about StemWave in general, if you have any questions for me about the company, whatever, now's the time. We're still going to talk about Robert's journey with StemWave, but throw some questions in the chat, and we'll kind of go one by one as we continue this Q&A. So, all right, we'll let people focus on the chat while we keep on going. We get a lot of people that are a little nervous about bringing in like a fancy shockwave, whatever system, because they think that there's going to be like this huge learning curve on how they can implement it into their practice. Maybe they think like their patients aren't going to pay for it, or maybe they think that their patients aren't going to go for it. When you brought StemWave in, how did you kind of pitch it to your patients? I know you probably started with your current patients. How did you kind of pitch it to them? How did you get them on board early on?
I had several patients in mind when I first got it. And so before I received it, I was prepping them. I said, with what's going on with you and the research I've been doing on this device, I think this might be helpful. And I said, it's not cheap. It's not anything that's covered by insurance, but I think it might be very effective. And so I did a little kind of prep beforehand with current patients and also with the other therapist, kind of letting them know if they're what they're seeing and what this does. And so the cost of it was like, will people be willing to pay this? And most are. I've had some people that said, no, I just can't do that. But and I try to make it as reasonable as possible, but I mean, it's costly. And even maintaining the equipment, there's an expense. So, um, but when people kind of get to experience it, it's like, yeah, they said nothing else is helping.
Yeah,
And so when they find something that is helping and it's not just helping with the pain, it's actually regenerative.
yeah,
And that's really a lot of what I use to I want to say sell it, but to convince them that this is a good avenue, a worthwhile avenue, because we're not just trying to deal with the symptoms, we're trying to create physiological changes within the body to help it to heal. And we're actually stimulating the body itself to do what it normally does. So we're stimulating that whole healing process to help people recover. And so there's not like the issue with side effects that you get with drugs. I mean, you can overdo stem wave and you can have some side effects, um, but you're stimulating the body to do what it does. And so and that's a lot of what I use to kind of tell people why I use this and why I think it would be good for them, is because it regenerates. And you can continue to see benefit even after we're finished treating you for several months because you've already changed the condition and the health of the tissue around that injury.
I think that's such a fantastic point, Robert. Like, I think so many people with how traditional healthcare is, where you get a prescription for some pain pills. I think a lot of people just assume things are just going to mask pain, and that is going to come back. And I think
Yeah,
the way that you're putting it, and this is great for other providers that are watching this to know, especially if they're thinking about StemWave and trying to figure out how it works with their patients in their practice, to give the patients an understanding, like you said, that it's regenerative. So yes, today we're going to StemWave you, and your pain is going to reduce by 30 to 50% or whatever it is on this first treatment, and you're going to feel better, and you're going to feel looser, and it's going to feel good. But just know that as time goes on, that treatment is going to build more blood vessels. You're going to build tissue back. I mean, we've seen it regenerate bone, regenerate nerves. Like, you're right, regenerative. Like, that's the key. You're going to be a better version of yourself after this. And it's not
yeah,
just about getting rid of the pain.
right. And that's why I tell them, I said, you'll feel better after one treatment most of the time. So, but really to get the benefit of it, you need several treatments.
Yeah.
And and so that's part of it. And when I was doing my research on shockwave, what some people may not realize, the literature on it's not very distinctive between a radio wave and a shock wave and a percussion wave. And so you have to kind of weed through a lot of that because you don't have the same regenerative effects with other types of devices.
Yeah.
If it's not a true shock wave, you're not going to have those same regenerative effects.
100%. We have a question here from Heather. Robert, I know you mentioned that when you originally brought it in, you pitched it to clients that you were already working with on the laser. Did you notice that the clientele that grew from having the product were primarily clients you were already working with or are new clients? I have a health and wellness practice that specializes in therapeutic massage for injury rehab, but I just opened this year, so my clientele is still growing. Would love to hear your thoughts.
So um, when I first started off and part of the marketing thing that was key, I didn't know how to market or how to even taking my existing patients, sending out emails. And that was where your team was super helpful. It really was not difficult at all to send out an email blast and let people know about it and have them come in and try it. So I don't know if she'll have the same, if she has a history of clients that she's not seen right now that can do part of the email blast, which is part of the program when I signed up, is that support's included. So that was helpful. I also had emails from the clinic that I'm renting space out of. They let me use theirs, and then they share in some of the revenue from that. So that was helpful. The kind of second tier marketing of doing some stuff with uh, Instagram and Facebook, I
Mhm.
think might be beneficial for her to kind of get the word out about what she's doing. Because that's just the key is kind of letting people know and letting them try it.
Yeah, I know that, we always like to preach um, low price point for the first treatment to try to get people in the door. And then once they feel it, that's when the care plans make more sense to them. And it seems like there's just, whatever your client base is, there are a ton of people that are living in pain. Like, they're living in chronic pain, and they may
Oh
just
yeah,
feel hopeless, and they may not be coming in because they don't think you can offer them anything that's going to help. So just letting them know that you have this new technology that literally does that exact thing that helps with chronic pain, get them in the door, low price point. I think that's like the thing that we see jumpstart our STEMway providers the most,
yeah,
especially early on.
yeah. And when I'm not trying to kind of bait and switch kind of thing, but I do offer the lower price point. But I tell them right off the bat, I said this is expensive,
Mhm.
but it is well worth it. And um, I'm just upfront with them. But I said, but I want you to be able to try it. So we're doing this inexpensively just to kind of help cover costs and let you experience it. So
Yeah.
yeah,
And I said this before, say it again, and I've talked to patients myself when you can't put a price on getting someone to be out of pain and to get their life back. Like they literally will pay. I mean, they find a way. There's other things that they may have been paying for, like, massage or acupuncture or, even like prescription pills or something. And if you can offer them something that actually works, all that
Yeah,
stuff goes away.
absolutely. In the end, a lot of times it saves you money,
Yeah.
um, because you're not dealing with the chronic issue anymore.
Yeah, I mean, there was, patients that, let's say they had some sort of like carpal tunnel, like you were mentioning with yourself. How much money are they spending on wrist braces and all sorts of gadgets that they're buying on Amazon all the time to make life a little bit more comfortable for them when there could be a solution that gets rid of it much faster and that, yeah, it's a little
Yeah,
expensive on the front end, but on the back end, you're never buying that stuff again.
yeah. And I tell you another way, which people don't really think about. I had another lady, hip pain. They said, well, you don't need a hip replacement or anything. But no one could really help her with her hip pain. We started doing the StemWave. She started feeling better. She stopped taking all the NSAIDs. And you don't think about the impact of taking pain medication and NSAIDs has on you, but it has a significant impact, especially on your gut. And then if you mess up your gut, you can mess up lots of stuff and lead
Yeah.
to all sorts of chronic issues down the road that you don't even realize. So
Yep.
just being able to get off of things like NSAIDs can really help a patient out.
100%. And you mentioned with that hip that she didn't need hip surgery, but we do hear this a lot. We hear about the patients who are scheduled for surgery
Oh
and
yeah.
they get on a treatment plan with StemWave, and all of a sudden they get another MRI or they get another X-ray, and the surgeon's like, "Wait a minute, where did it go? Where's the injury? It's not here
Yeah.
anymore." And
Yeah.
they get to cancel their surgery dates. I mean,
Yeah.
that's
I had
that's a
a
huge money
patient.
saver if you ask me.
Yeah. Yeah. She was convinced, and she had all the signs and symptoms of a meniscal tear. And we started her on StemWave. She had some still just intermittent pain and ended up getting an MRI. And they said, well, there's no meniscal tear. There is this little calcium here. It looks like there could have been something.
Mm.
But she said, there's no meniscal tear. But she's pain free now. So
Wow. Yeah. We got another question. This one's from Nick. So you mentioned that you did stem wave on your wife, Robert,
yes,
and that she felt good after the treatment, and then her shoulder pain came back a little bit. What I don't want is to charge someone $80 to $90 for treatment to have them see results and then have the pain come back after a few treatments or a week or so after the session package that they bought. What are your thoughts on that?
I have a few different thoughts on that. One is that was just a single treatment that she had, and then it came back a couple weeks later, which I would expect anyway with any type of injury. But it is the kind of package where you're looking at probably 8 to 10 treatments where you actually see some real uh, physiological changes in the system. Um, Not everybody's going to be pain free when you're done with them, unfortunately. But I've had several people that's like, it is so much better. I'm manageable. I'm doing the things that I want to do. Um, and I guess you want to give people hope, but you don't want to give them false hope as far as saying this will take away everything, it'll cure all. And because there's nothing that really does that. But this gives you probably the best chance of getting better with a lot of different things. I've actually had a couple of patients with meniscus type injuries that have done really well. So, and kept them from having surgery where they were looking at having surgery. Yeah. So I get it. Um, you don't want to waste people's money. I don't either. But I don't try to give them any false hope either that this is going to permanently fix it. I try to be realistic, um, and just tell them, here's what I'm seeing, and let them judge it for themselves.
Yeah. And I think, that first treatment is more about relieving some pain and
Yeah.
getting them to feel what's going on because StemWave feels different than probably anything that they've ever had done to them before.
Yeah.
and letting them know, like it's giving them, like you said, hope that, hey, if we continue on this treatment plan, we're going to see some, most likely, we're going to see some really great progress here. And yeah, some people, they wind up being completely pain free and they're great after it. Some people, it reduces the pain, in half, which for them means everything. And then maybe you come back on maintenance programs, but it is a protocol. It is a treatment plan. It's very rare. I've seen it though, but it's very rare that somebody comes in and after one treatment, like everything feels great again, right out, like
Yeah,
100% better. Some
yeah,
people, but like you said, everyone's different. I mean, you have to also take into account how that person takes care of themselves. Like, how is their diet? Are
absolutely.
they sleeping enough? Are they overweight? Like, are they drinking alcohol? Are they doing like? There's so many different things that can factor into how they heal. Um, but it really is mostly about like just getting them that first treatment to feel what's possible.
Yeah. And there is, with that first treatment, I mean, you're talking about several different mechanisms that the shockwave stimulates within the system as far as the attraction of stem waves, the recruitment of growth factors. It also works on the gate theory of pain with the sodium channels. So you get this aspect of pain relief, but you're having all of these other things that are happening in the system to help with the healing process. And a lot of times I'll tell them, I said, yes, it does feel better. The pain, some of this pain relief is just temporary, but what we're trying to do is stimulate healing. So
And you also mentioned before, I think this is good to bring up, is that, once those patients walk out of your clinic, you're not in control of them. Like someone
yeah,
may have hurt themselves playing basketball. You give them stem wave treatment, it feels great. They leave, they go play basketball right after. And they
yeah,
come back and
yeah,
like, hey, it hurts again. It's like, well, yeah, you just jumped on it again. Like you said, that one patient, you have to, I think it was your pastor, you have to
yeah,
just taper down their activities that hurt in the first place until they
yeah.
really like are
Let
healed.
things heal. Yeah.
Yeah, exactly. Okay, Heather's back. Follow-up question. Um, what's the reason health insurance does not cover stem wave treatments?
Yeah. You'll have to talk to them.
Exactly. Exactly. I have some theories
Yeah.
of why that is.
Yeah.
There's nothing in it
Something
for them.
works. I don't know.
Yeah. So yeah, if you're getting people feeling better, you know, doesn't
Yeah.
really do
And
well for them.
so I didn't tell you this part of my story, but I got so tired of the insurance game. And all that I do now is just private pay. I don't do insurance stuff anymore because they will suck you in at a certain thing and then say, "Oh, but we're not going to pay that anymore." And they'll cut down on the reimbursement and different things. And I'm just like, no. I said, I provide a service. I provide something that is of value. If you want to pay for it, great. If you don't, it's up to you. I I just came to the conclusion I don't want to deal with insurance. If what I'm doing for someone is not worth it to them, then they don't have to pay for it.
Yeah. And that again, that brings us back to uh, you can't put a price on taking someone's pain away. And once they
Uh,
once they feel that for the first time, the conversation becomes a lot easier for whatever your treatment,
yeah.
price point
And
is.
all my care is one-on-one with the patients.
Yeah.
And I wouldn't let anyone else do the stem wave anyway, because I tell you, there's really an art that you develop in using it and how
Yes.
you direct it and then what you're hearing and even what you're feeling through the handpiece
Yeah.
as you're treating a patient. You can sense, you can tell things. You can tell by
Yep.
the sound and you can tell by the feel of it when you're hitting spots that are inflamed or injured.
All right. My last question for you is if you were going to talk about StemWave to a colleague or a friend, maybe another
Yeah.
PT, what would you say about it to get them to understand how great it has been for you?
It has really been revolutionary. I would say, I don't want to tell anyone that's kind of right in my area. If I had a friend that's kind of doesn't live nearby, I'd be glad to share that with them. I'm just kidding.
Yeah.
So no, that if you want to have something that has helped patients recover better and faster, um, then you'll want to invest in this. I mean, it I still do everything else that I've ever done before with the dry needling, the exercises, getting them to recruit the right muscles, getting them to not compensate, and watching their movements, and we still do all that same stuff. But there's nothing else I've had that has really helped people to heal like this.
Beautifully said. All right. Well, with that, we're going to wrap up. Before we end this, though, I'm going to put in the chat here. So everyone look at your chat. It's very simple. It's just our website, stemwave.com. If anything that Robert and I have talked about today piques your interest, if his stories, his success stories, his wife's reaction, seeing patients, miraculously have their pain go away and, get back on their motorcycles and cancel surgeries and all that kind of stuff. If you are looking for a true regenerative, non-invasive modality to bring into your clinic, head to our website, book a call with our team. We talked about it. Our sales team phone calls are much like this, very conversational. We want to know about you. We want to know about your patients and what you're doing in your clinic. We don't work with everyone, and that's by design. We want to make sure that this is a good fit for you guys because, like I said, we want to help people too. And if it's not a good fit for your clinic, it doesn't do well for us. So go book a call with our team. We got that 60-day trial. It's very, very easy to do, no pressure, and we stand behind it. So with that, Robert Funk, you've been excellent today. I do have one tiny question that I'm
Sure.
going to sneak in here. All right.
Okay.
So we're talking about Texas A&M, Auburn,
Yes.
and Alabama, three places that you went to school. Who do
Yes.
you root for?
War Eagle.
Oh, wow. Okay. He's an Auburn man. Very good.
Yeah. Oh, I now Texas A&M is the second.
Okay.
I had one son that went to Auburn, one son that went to Alabama. So I still kind of still root some for Alabama too.
Okay. I mean, you really can't lose with that with those choices, but I was just so curious. I
Yeah.
was like, what does that house look like? And we've
Well,
got,
so I met my wife at Auburn, and that was probably the best experience, both uh, in many ways. So
that makes sense then.
Auburn's kind of got my heart. So
Awesome. Love it. All right. Well, thank you again. This has been excellent. Appreciate your time, appreciate your stories, and can't wait to check back in another 6 to 12 months and find out how you're dominating your industry in Alabama.
would love to. Thanks,
Awesome.
Ben.
All right. Thanks, Robert.